Good afternoon. After all this practical series, now we are focusing a bit on some theoretical parts, some of the good sessions, how to get sensitivity of the patient, how to probe the needs of the patients, all types of need. What Vijay sir always told, that the basic need of patient, you need to identify the basic need of patient. Need can be soric, psychotic, syphilitic, any need. Need can be love, support, esteem. So on this topic, I am inviting the most consistent speaker of Happy Gujarat, Dr. Amit. Welcome.
First of all, thank you. After a long journey from 2015 to 2019, consistent teaching of sir's knowledge and sharing with friends, I'm very fortunate that I have a genetic inheritance of teachers in my family. So it is one of the God grace that I am here to give you the basics knowledge sir has given us, and I am sharing here regarding the topic needs and sensitivity of the constitutions. We have arranged this lecture series of 4 lectures. The first lecture is little bit theoretical. The second lectures, third lectures, and fourth lectures of this series of needs, it's a quite practical, and we are going. But before we going to have some practical aspect, we need to understand the theory first, and after that we can have a practical approach to particular case. So let's begin the topic need and sensitivity of the constitutions. First of all, I give tribute to our master Samuel Hahnemann, who have given us this wonderful divine science, and we are very fortunate to handle this science and suffering humanity. Again, I am very grateful that we took the blessings from our Guru, Dr. Praful Vijay sir, who have breached this science of homeopathy with the modernizations, and this modern techniques or modern skill we have utilized in our practice. So I am very fortunate that sir has given this wonderful knowledge, and sir's always slogan was homeopathy is mathematics. So it is the homeopathy is mathematics, because when we know the modern science correlate with the modern science and practice, then this is become a mathematics. So this is the wonderful science. No need to give my introductions, as everybody knows myself, Amit Gohel. So starting this topic with sir's slogan, I do not see what mind does not know. See, अगर हमें पता ही नहीं है कि पेशेंट का पूरा हिस्ट्री ले लिया, पूरा फिजिकल हिस्ट्री ले लिया, जनरल्स ले लिए, थर्मल्स ले लिया, फिर क्या होता है कि जब जूनियर्स होते हैं ना हम, तो फर्स्ट ऑफ ऑल जब शुरू में प्रैक्टिस स्टार्ट करते हैं तो हमको वही नहीं पता रहता है कि मेंटल में लेना क्या है, पेशेंट को कैसे मेंटल हिस्ट्री पूछना है, मेंटल हिस्ट्री कैसे लेंगे. अगर हमें पता होगा कि हमें क्या लेना है, क्या नहीं लेना है, then we can have a process of dealing with the case. So sir always says, I do not see what mind does not know. If we don't know about the need, then we cannot find the need of the patients. If we don't know about the sensitivity, we cannot find the sensitivity of the patients. See, we have to treat the patients from core, or from the deepest level of the disease process, which arises from sensitizations, or it may be arises from the deficiency at the level of need. So in that case, if we don't know about that need, then we cannot practice in a proper way. So this is what the topic I have today is. To first step to prescribe a GCS is the need and sensitivity of the patients. let's start with this process. Now, why this necessity is, why this is the necessity of the need and sensitivity of the constitution to be known. If we don't know about this process, then we are dealing with a lower layer of the disease up to second or third layer of theory of separations. In that cases, we can prescribe wonderfully and get a result, but it can be a suppressive, it can be a curative. But when we go in a higher disease like a hypertension, diabetes, thyroids, and higher level disease of the fourth, fifth, sixth, and the seventh layer, in that case, we need to understand the basic miasm as well as the basic needs and sensitivity of the patient. So in that case, we have to know that what is the need and sensitivity. This is the necessity of the needs and sensitivity. And for that, what we have to do, we have to prescribe the GCS. See, every case which comes to us with a three process, we always know what sir has taught us, that to prescribe the GCS, we need to know the miasm. To prescribe the GCS, we need to know the miasm. What miasm is? Miasm is nothing but a process undergoing inside the human body that it produces a disease in a three particular way. So always sir has correlated pathology with the human science and pathology with the miasm. So sir has given a wonderful understanding that the every disease start with the process of inflammation, what we call as a SORA or soric miasm. When the soric miasm has going on, and it can end into two processes. Either it can end into recovery state, or either it progress to a different mode of pathological process. So we have a two process. First, this is one is a physiological process, and the second one is a morphological process. In a morphological process, we have a two process called as a constructive morphological process and a destructive morphological process. In order to maintain this all is given in aphorism number 74 by Sir Hahnemann, that when the constitution is injured by something, either allopathic medicines or either strong medications or either emotional trauma or anything, then these constitutions defend in a three process. The first, it is exalt the sensitivity or deprive the sensitivity in the form of physiological process. We call it as SORA. It produces dilatations, contractions, relaxations, and induration in the form of a psychosis, or either it cripple the body and destroy the body. And the third process called as syphilis. So to prescribe the GCS, we need to know these things. And to prescribe GCS, we need to know the needs and sensitivity. This is the necessity of the topics. Now, see, in every miasmatic process, there is a specific approach. And according to approach, you should prescribe, you have a wonderful result. So in that case, I am sharing with you one of the best chart what sir has proposed, this approach to disease according to miasm. See, first and foremost things, we need to understand the what miasm is going on in the pathological process. According to that miasm, we have to find out what was the need and sensitivity of the patients. Okay, so in that case, this is the wonderful approach. You must snap these pictures, very important chart to practice the homeopathy. So in that process, so we have divided this chart into three processes. One is the physiological functions, second is the structural physiological, pathological, and this is structural pathological. So these two are the morphological chart, and this is the physiological chart. So in always in a physiological chart, we have a defense mechanism in the form of inflammation. So this is inflammations. This is soric inflammation. Okay, when the inflammation goes further and cannot cope up with the system, and the system needs to be insecure about this thing, so system started fortifying, and when the system started fortifying, it produced a structural growth at the level of morphology. And when again this process is going on, and it cannot cope up with, then finally it goes into destructions. In aphorism, Hahnemann has mentioned that you cannot check unless and until homeopathic aid is given, the miasmatic process cannot be checked. Okay, the homeopathy is the only methods and only things which restore this process to a normalcy or to a health. So this is what it is in aphorism. It is written that when the miasm is advancing, it cannot be checked unless it is aided by homeopathic means. Okay. So in what happened in psoriatic cases? Mostly in the psoriatic cases, it happened is the inflammation. So inflammation goes into redness, color, dolor, pain, infections, irritations. There is a spasms, sensitivity. See here, it is a sensitivity. Now, why this sensitivity? Inflammation doesn't come in a way when the sensitivity got hurt. Why sensitivity got hurt? When the need is compromised. That's why the inflammation has started. So, from that sensitivity, neuralgia, and altered biochemic, in that case, there must be the causative ailments. So, with the causative ailment, it can be either a physical trauma, either a radiological trauma, or either a mental trauma. Mostly, it is a mental trauma which affect it. So, in that case, in a most psoriatic cases or in a most acute cases, you do not require genetic constitutional simillimum. You can require the remedy according to aphorism number 5. In the most acute cases, it is the exciting cause which provoke that. Now, why it is exciting cause? Because everyone is sensitive to these things. That's why the exciting cause is provoked, and that exciting cause is provoking the illness. So, in that illnesses, we have a sensitivity. So, in that case, we need to understand the reactions and the sensitivity and ailment and the prescribe. No need of GCS in acute physiological cases. Very clear? Yeah. Now we go further into structural changes. When there is a structural changes in the body, there must be two changes. Either a fortification in the body in the form of excess or growth or a tumor or indurations or a thickness or anything else, depositions. Okay. And the second process is a destruction of the cells, necrosis or apolysis. So in that case, so in fortification, we have accumulations, proliferation, depositions, and synthesis. Synthesis at the level of protein, either elastin excess or elastin less, or sometimes it is a fibrin excess or fibrin less. So in that case, we need to find out the GCS. Now, why GCS? Because in that case, we need to consider the whole genetic factor, because this is the adapted state of the body. So why this adaptation has come into psychotic process? Because the first sensitivity or need of the person get compromised, and that compromisation goes into adaptations due to insecurity and trauma. So in that case, we have to deal with this psychosis, and in this psychosis we require a GCS. Am I clear? The third process, a pathological structural process, it is called as syphilis. In this, there is apolysis and apoptosis of the case. It may be gangrenes or everything, necrosis. So it can be represented as a 4-point: exaggeration, distortions, perversion, hysteria, and destruction. Till this 5-point, there is the sora and sensitivity is there. So in that case, we required a syphilitic background of the reactions as well as the basic needs, the sora. And the rest too, when there is autoimmune and genetic mutations, in that case, this sensitivity has been altered by the perception. So in that case, we have to remove the altered perception first, and then we have to maintain it, to reverse it by GCS. So in this pathological structural changes, syphilis, we require two things: either a GCS or a state remedy, or a state remedy followed by a GCS. Am I clear? Very important chart to practice. Every case should be classified in these three, and according to that you have to prescribe. If you do this, it is very easy to practice homeopathy. Okay. Now further, see, always you have to consider the cause has to be there. So cause is because if I am not sensitive, if I am not susceptible, if I am not sensitized by the environmental process, then I am not affected. If I am sensitized or susceptible, then and then the sensitivity got hurt and I am affected. Okay, so there must be cause is always associated with the sensitivity. So you need to find out what has happened and what has caused this thing to first point. That is called ailments. So many a time we have most of cases. I recently had a case of appendicitis. In that case, uh, the case was a lady, and lady has a pain in abdomen, and she has a severe abdominal pain. I advised to go for the investigations, and she undergone a USG. So in a USG, it was found that acute inflammations of the appendix. So straight away I ask, if we know this process, then we need to find out the cause. So straight away I asked, what has happened? So she said, nothing has happened, nothing has happened, nothing. As usual, all patients will tell that nothing has happened because patient doesn't know what sir used to ask or what we physician need to ask. So I asked, does you have some quarrel in your family or outside the family? So she said that yeah, not in a family, but it is something in the outside. So obviously we know the appendix is a juncture where there is a connection with the partners or outsider which can cause the inflammation or which can irritate. So in that case, what happened? So she said that due to this COVID situations, the financial conditions of the family and the condition was very poor, but everybody in the family, everybody in the society, those who are rented, we are living in a rented house. So the owner of the house, most of in the society, owner of the house has given the rent was not taken. Rent was not taken for many people in that society, but the owner of this house was not willing to leave the rent, and he wants rent because this condition was very poor. So we are not here to give that rent. And according to that, the owner came to my house and he was very abusive and he used bad words and everything. And they told my husband a bad words, and I was so angry. I was so angry that I should go there and I should make a hit on the face, but she can't. And that was the case. That was the case. The resulting into appendicitis. So in that case, I took the rubric anger, suppress, and inflammation appendix. The remedy prescribed was staphysagria, and she is better with the staphysagria. Within 3 days, the USG report was normal. So in that case, every case you should go with the cause. So this is what my clinical experience I am sharing with the correlation of our studies. Okay. Now further we go into this. So in that case, see what you have to find out. This again, you should take the snap of this chart, very important chart. In that case, what to find out? In a physiological inflammatory changes, you should find out the cause and the ailment. That's all. The only thing is enough to prescribe the remedy. Any remedy come in the physiological process. Any damn remedy come in the physiology. It can be antisoric, it can be non-antisoric also. Okay, so any damn remedy come into this. But in that case, you have to find out the cause and element from. Okay. Again, when we go into the fortification process, structural pathological cases, the cause is there. But when the process starts from this to this, the cause has bloomed. But this cause is associated with this. When there is a sensitivity, the sensitivity got converted into this process. It is called as a fear or insecurity. So this sensitivity got converted into fear and insecurity. You have to find out why this person become insecure, why this person have a fear, and that fear has to find out. Sometimes the fear become exaggerated to such an extent that they believe falsely and they go into the wrong perceptions or altered perceptions. This is called a delusional state. So in that case, we have to find out this. Am I clear? Now the third point, the structural changes. In that case, when the person goes out of control, when the person goes out of control, here the cause is very important again, because the starting point goes normal physiology, and to the point where it control has losing and it goes out of control. So that was the causative point of these things. So you have to find out the cause, and when it goes in out of control, so you have to find out the state goes in out of control. So it can be because of delirious state of the persons, or it can be exaggerations, or it can be distortion in the form of delusional state. So in that case, you require altered perceptions. Am I clear? So this is what very important to prescribe the medicine, and to prescribe the medicine again from this perception. These perceptions, why this perception is developed? This perception is developed because of some fear and insecurity, and this fear and insecurity developed because of some sensitivity and need of the person. So everything is connected from this to the last. Okay, so we have to find out these perceptions. Say for example, I will give you 3 rubrics. So one person feel that nobody take care of me. We said that, see, everybody in the family is going to take care, but person feels that nobody is going to take care of me. So person feels forsaken, one thing. One thing. Second, nobody look for me, or nobody taking my advice. As I am an elder in the family, nobody is taking my advice. Second is neglected. And the third process, which we called as everybody in the family is neglecting me to such an extent that I am nothing in the family, or they may remove as if I am dead, or they may remove from the family. This is the feeling. This is not the patient words. So in this 3 process, what is this? See, every person has a specific need. When the person's need was a love, so person feel I am a forsaken. Nobody loved me. So rubric is forsaken feel. When the person feel support, so person feels support, need is support. So he feels that neglected me or deserted me. Whenever I needed something, they neglect me, or whenever I needed something, they desert me. And when person feels the highest level of esteem or a need of esteem, he feels that they will be cast away me. So this is what we called as a despised feeling. So the person's word remains same, but if we know the basic sensitivity of the parts, we will go to the rubric which is very, very important to shoot it to that thing. And see, if person feels I'm not getting loved, and you take neglected, your rubric can be wrong, your entry point can be wrong, and that lead to the falsification of the medications. Okay, so in that case, need is very important. So if we know from childhood what was the basic need, what was the evolutionary need, and what was the perception and insecurity he developed into this altered state of disposition, or altered state of delusional state, or altered perception, then we have to have a perfect rubric. That this rubric is very important for this. So many a time a person is sensitive to rudeness. Say for very simple rubric, sensitive to rudeness, someone scold in a very harsh way or a rude way, so they are sensitive. So what we take, sensitive to rudeness, a common. But if the person says, why you had said to me, mane nicho dekhaya, so you have looked down upon me. So this is what ailment from scorn. So again, the scorn comes into the esteem level. I need to be like this, I need to be respected, but they didn't give respect to me. They scorn me. So this is what again the sensitivity. This is a soric sensitivity. When scorn goes into perception level, it is despise. As we discussed, Anand, in the one case, this was the patient was in a very scorn feeling, and that scorn feeling goes into look down feeling, and look down feeling goes into the state of altered perception of that called as despise. So this is what we have to correlate from SORA to syphilis. Very important to understand these needs. Am I clear?
Yes.
Now we go further. Little bit quite theoretical, but be with me. So this chart is very important. When we need to prescribe the homeopathy, or we have to be a right homeopath, you need these three things to prescribe GCS. You need these three things. First is need and sensitivity of the patient. Second, the disposition of the patients. And the third, the syphilitic symptoms or altered perception he had developed out of their life situations. Okay, so we are here. This gives you a 4-lecture series, followed by we are going to have a dispositions, and followed by we are going to have a syphilitic symptoms as well as the perceptions. So this is what we are trying to give you or sharing the knowledge with this process. So to give a GCS, we need to know these things. So we are here to first step. That's why the video title was the first step to GCS is need and sensitivity. Okay. The second step was disposition. Without disposition, you cannot practice homeopathy, because Hahnemann has mentioned in aphorism number 210 to 230 the importance of dispositions. Very important, because the mental dispositions is the key to prescribe the homeopathy. Okay. So now we go to the process that we have a miasm, SORA and soric manifestations. Okay, so SORA and soric manifestations. Soric manifestations, it is something that body has developed as a disease process, or it is either inflammation at the level of physical, or it can be inflammation at the level of mind. It is not considered to be an inflammation of mind. It is considered to be some sensitivity got disturbed. And what is SORA? SORA. See, in Organon it was written that SORA is the mother of all things. So SORA is nothing but SORA is a basic need. So every human being has a certain basic needs. When the need is fulfilled, nothing is going to happen. He can live very healthily. He can have a good homeostasis. Okay, but when the need is compromised, it can produce the manifestations. So when the SORA is compromised, the soric need was compromised, the manifestations that develop, it is called as soric manifestation in the form of defense of inflammation due to trauma or disturbed basic needs. Okay, so why this need is arise? Why this need is arise? Now we go further. See, we know soric manifestation is there. Soric manifestation because of SORA, and SORA is a need. So why need is arise? So need is arise because of one law. We are Dharmesh. We have this law since the very beginning in our college days. When deficiency arise, desire comes. When deficiency arise. So this is the need. So need arise out of deficiency. So when there is a deficiency, there is a need. So why we have a deficiency? This is very important. So we go further. We born with a deficiency. Every person comes to this world and take a birth because of certain cause. See, we are here for a certain cause. As a spiritual journey of learning, we know that we are born out of certain things, and we are born to do certain cause. So we are born for a certain cause. Say for example, right now I am giving you a lectures. So this is a God wanted me to share with you the knowledge. This is the certain cause. So same way everybody born with a certain cause. And that cause was a lake. That cause was a lake. So say for example, the electricity, energy, water, everything flow from higher concentration to the lower concentration. We know the law of thermodynamics. Higher concentration to the energy transform from higher concentration to lower concentration. So everything is in a, if there is a balance or equilibrium, flow, transfer, stop. Say for example, if the concentration is high, this concentration is low. So it flow from higher concentration to lower concentration. So this goes down, down, this goes up. When this is going into balance, there is top of the transfer. Okay, but what happens? Every person born is energy transformed from cosmos to immaterial body. So in the cosmos there is a higher energy. In a material body it is a lower energy. So in this lower energy, this is the lake, and that lake causes need. This is the deficiency. Okay. So every constitution born with the deficiency, and deficiency give rise to need at the either a physical level or at the mental level. Say for example, why this need is because this need is fuel for survival. We are here, we are born, so we have to survive. According to Darwin's law of theory, survival of the fittest. So every organism need to survive, and every organism need to survive. For that survival, they need some fuels, and that fuel is something called as need. Okay, so at physical level, we need survival for air, water, and food. So, for example, when we born, physical level, when we born, we need these physical things, air. If we cannot breathe, can we survive? We have a cases of asphyxia neonatorum, and that asphyxia neonatorum case, so because of the need of air was compromised. Okay, so this is what the basic physical need, and this was a basic mental need. See, remember this chart is again come to in the next slide, because I am going to share with you this process. So to understand this need, see what sir has given us, that we have to correlate the science with our philosophical understanding, so that to understand this basic need, sir has given a Maslow's hierarchy of the need, and from that need we have to understand why this is going to happen. So Maslow was a psychologist in USA, New York, and he had developed a theory of motivations of the need. And in that motivational theory, he had given an initial pyramid that every person's need has these things. So every person need, basic need was from the base to top. When one need, what Maslow has said, when one need is fulfilled, it can goes into another need, because there is oneness of fulfillment, there is a lack of another, so they can evolve. So in that case the evolutionary need is going on. So in Maslow's theory, well, first point is physiological need, second point is a safety need, third point is the belongingness and the love need, fourth point was the esteem need, and the fifth point was the self actualization. But initial Maslow's theory, it was in an initial pyramid. Maslow has added two more components into this. The first, physiological safety, belonging, and esteem need was there. But in that two or need as added, that was a cognitive need and aesthetic needs. And the self-actualization. The last need was actualization. And in the 1990s, some other authors added this chart as the need of this is a physiological, safety, belonging, esteem, cognitive, aesthetic, self-actualization, and transcendence. Now we go one by one. What was that need was? What is the physiological need? The physiological need is a need that in which the human being survive with the basic need of air, water, food. So everybody has this basic need. This is the physiological need. So this everybody born with this, and they have to survive on this physiological need. When this physiological need was normal, say for example, if a child born in a very rich family, where the abundance of the foods and everything was there, so he had no need of these things because it is supplied. And suppose a child born in a very low caste family or in a street family where there is a scarcity of the foods and everything, so in that case the basic need was food. So they go into gluttony, they go into eating more foods, because to survive myself, if I didn't get food, so they go into this government. So we have a remedy government, rubric government. Okay, Antim crude was like this. What was Antim crude? Antim crude represent as a pig, or where pig lives in a dirt, there is a scarcity of the foods and everything. So because of that need, that develop gluttony, that develop a very government type of food. So he needs more food. When this need was fulfilled, then they go into another need, belongingness and love. Okay, so every remedy goes have a evolutionary needs. Okay, when we go higher up, this was the basic need of the food, air, waters. Again, in that case, one need is the sex. The sex is also a physiological need. Okay, when we go higher, the safety needs. So safety needs comes in that case. The every person wanted to be guarded by a process of a life, and they need a safety. So always we are trying to make the safety. So in every case, what we think that, see sir, the in this COVID there is no situations, and there is a situation that no need, life is very uncertain and we have to die, and it happens. We see in our family lots of people die. So this create insecurity, and for insecurity they want safety. So what they do, they started taking a mediclaim, they started taking insurance, they started taking term insurance and everything. So this was the process that they are in this need. Okay, so why I'm explaining one and one point, in that case they need to be have a safe. Say for example, we have a lot of history that a child or adult person come to us and we ask the sensitivity of the child. He said, when we are in a childhood, we don't have any monies and nothing and everything. Okay, we live in a one room kitchen, and nowadays we are living in the bungalows and everything. So we said, how can you develop these things? See, he said that we don't have a money, we have to work hard. We have done lots of work, we started diamond works and everything, and develop these things. So this is what is the basic need. The basic need was lack of money, and nowadays he's showing the money. So this is a psychosis. And when he goes into syphilis, they have, although prosperous, he feels I am poor, like Sorainam. Okay, so this is a process. So same way, this is a safety need. In a safety need, there must be a safety of a self and safety of the surrounding. So they wanted to guard everything by means of one thing is money. Okay, the third needs is a belongingness and love needs. Very important needs, because every persons have to live in the environment which is social. When we socialize ourselves, we need to care for each and everyone. We need to have belongingness with this is my one, this is my brother, this is my sister, this is mine. Okay, so from that this need arise. So everybody needs that care, love, nurtures. So mother has also these feelings. So this is a need, and this need is arising belongingness. See, we have a case from belonging needs to the state of syphilis, that we have learned the phosphorus. Phosphorus is very affectionate, kisses everyone, loving child, is a sora. When it goes into psychotic state, he become very diffusive, he become very extroverted, and magnetic state and everything. But when it goes into state of syphilis, he become very indifferent to loved ones. So this is what, from perception of love to indifference. So this is the belongingness. But we have indifferent to loved ones. So sepia is also there, phosphorus is also there. How can we differentiate both? We can differentiate from the basic needs. Okay. So in that case, the need is belongingness. So up till this process, it is very basic. Everyone needs. Then we go further. This is the esteem need. Now, what is esteem need? See, every individual, when in the society or a socials, they need to be recognized, they need to be respected, and they need to be valued. So, in that valued, that this needs comes. So, when we achieve certain level, they want this is my value. It is adapted. Actually, it is not, but it is adapted. So this is the ego inflation. So in a esteem need, mostly the egoistic part comes into process. Okay, so ego is increasing. That I am a great, I am a king, I am a queen. These are the feelings that they develop because this needs. Because I am born in like way. Okay, see, Platina has a feeling that I am a very superior. I am very high, top at the high. I am a queen, everything. But again, this need comes out of some insecurity at the level of that she feels I am very smaller, I am very inferior. That's why this inferiority goes into exaggeration form and projection into esteem need. So this is what esteem needs. So everybody need to be respected. Everybody need to be valued. And why this need is very important? Because right now we come across to a very autoimmune disease called connective tissue disorders, mixed connective tissue disorders, RA. So every need is also associated with particular organ of the body. So for example, esteem need is associated with the bones and connective tissue, because when we understood the GNM theory, according to Hammers, he said that this needs when the person feels devaluation, when the person feels devaluation either from someone else or either by a self, okay, then the esteem was compromised. Then their esteem was compromised. There must be compromisation at the level of connective tissue, at the level of bones, because these are the strongest ones. Okay, so when we know esteem need is very important, because in a most of bone disorders we need to find out the self devaluations either by certain process or by self. Okay, so this is very important. Now beyond this, these two things is nothing but it is a part of esteem need only. This is the part of esteem need only. When we go to the theory of Sigmund Freud, in a Sigmund Freud, he said that there is a 7 process of a development, and in a 7 process, one process I need to remember, that is the projections. So when there is an insecurity inside, they start projecting different things outside. So for example, we have a projector here and we have a big screen. In a laptop, it was very small screen. So this is projections. So in a projections, these two needs are very important. What is the cognitive needs? So always we are the seeker of the knowledge. So right now our need is cognitive need, because we are knowing something. This I'm sharing something, sir is sharing something, and we are getting that knowledge. So knowing something, it is called as a cognitive need. And they started to evolve because this need is for evolutions. See, from basic to evolutions, I'm going little bit ahead. So this is a cognitive need. Now what is aesthetic needs? So aesthetic needs is also a part of esteem needs. This is what projecting, that means cognitive projections. I know everything. Say for example, sulfur. Sulfur is postering everything. Sulfur is saying everything. I know everything. I know Google. This is these things. I know these people, and these are my friends and everything. When you inquire a little bit more, and they said nothing. Okay, so this is what sir always used to explain this word, jack of all and master of now jack of all and master of none. This was the sir's word. I forget that. Jack of all, master of none. This was the sulfur. So why? Because sulfur has this needs, cognitive needs. Okay. So they started projecting, they started posturing, they inflated chest. I am everything. Okay. Same. The aesthetic needs. The aesthetic needs. So in an aesthetic need, they are more concerned about the appreciations and their beauties and the looks. So in that case, we have a aesthetic need. It is again a part of esteem needs. So in a most of time, beauty is associated with a certain remedy. We know certain beauties. Say for example, palladium. So palladium has a sensitivity that what I am looking for. Yes, they need appreciations and they want approbations from others as well, because they want opinion from others. They are very sensitive to opinion of others because according to that beauty and aestheticness look, they are very sensitive. So in that case, they are sensitive to opinion of others. These are the basic aesthetic needs. When this need get fulfilled, so for example, these all are evolutionary need. These all are evolutionary need. From basic Sora to psychosis to this, then this goes into higher version. What is the self-actualization? The self-actualizations means they have to develop everything from zero, and now they evolve to develop self. This is a self-development, self-actualization. This is the process of need. So in a self-actualization, development of the self. So many spiritual persons or many persons that goes into a process of developing self, or they are trying to help the other to develop their personality. Nowadays we have a personality coach and everything. So this is psychotic, but really some are reaching to certain example. I would uh, say for example Sadhguru. Nowadays Sadhguru is famous. So Sadhguru is in a state of self-actualization. I can say this is not exactly the things, but I can say because he is trying to develop the nations, and he can go into the state of transcendence. The transcendence is a state in which he develop everything and he develop lots of people like him and he develop lots of gathering. So what we call it, our sir is like that. Sir has transcendent everything. And nowadays we are giving the same sir's knowledge to all of the students. So this is what sir's transcendent state to this process. This is just a correlation. Don't take it. But this is the Maslow's hierarchy of need. From that need, we have to go from the basic. Am I clear? This need?
Yes, sir.
So the need arise out of these things. Again, the same chart. The physical need was air, water, and food, and the mental, psychological need was love, support, and security, esteem, or respect. So we go with the primary need. The air is the primary need. So from primary need, the most important need is air. The first system that start working in the newborn is the air system or a respiratory system through which the life vital need is fulfilled. So from that the survival start. Okay. In the womb of mother, the fetus cannot respirate, breathe. When it comes out, the respiration start. So first need was air. When the air is compromised, the child goes into asphyxia neonatal. So the survival is state. So for survival, the most elementary need is air to live in the earth. So what was the function of air? So it is the most for survival. Again, why air is needed? Air is combined with the food and converted into energy, and it is essential for the activities. So in most of acute cases, we are dealing with activity of the patient. When sora is compromised, activity either goes into dullness, either goes into increase, or either goes into sleepiness. So this is it. When air is converted into food and energy, that essential for the activities. So in an acute state, we always say, are you dull? Are you sleepy more? Are you more active? And everything. So this is very important that this is a basic need because this is compromising in acute state. Life that include working of the life supporting systems, body, and performing normal activity and locomotion. So this energy is used for locomotion. When see in the last year COVID, everybody is going to take the oxygen cylinder to home because the air is scarcity of the air. This is the basic need of the life to move, to advance our life, and this is life supporting. So this is air is very important. So respiratory symptoms is concerned with the air intake assimilation into humor. When air goes inside, it can assimilate into humor. Humor means blood, distributing it to all the nooks and corners of the body to be utilized as a raw material for energy production. You know, you say in the last COVID situations, one of our physicians, infectious disease physicians, has given one literature called as happy hypoxia syndrome. Happy hypoxia syndrome. Patient says, I don't have any symptoms, I don't have fever, I don't have cough, I don't have nothing, but I feel just lethargic and weak and everything. And when we checked the saturation level was very low, almost 80 or 85. So this is called as a happy hypoxia syndrome. So what this, when the when the air does not goes into blood, the energy got reduced because this air is the materials of the raw materials for the energy, and the production and removing and cutting away the eliminating product like carbon dioxide is a package existing in the form of cycle that go on continuously in the individual to survive. So this happy hypoxia, there are lots of patients who die due to happy hypoxia because they cannot have this process. Am I clear? Again, what was the function? It is, therefore it is called as a cycle of life. Air is a life. We call it air is a life. If there is no air, we cannot live. Okay. The cycle of life helps or keeps all tissue, organ and system in equilibrium, and we call it as a homeostasis. When all the sensations and functions in a normal harmonious way, then we call it as a health and homeostasis. So when the air is in a proper way, then it is a homeostasis. And homeostasis is disturbed. Okay. When the homeostasis is maintained normal, it is called as a health. And when this cycle of life is disturbed, we produce illness or disease, and disease that precipitate. Okay. So this is what the basic need at the physical level. So deficiency of the air in oxygen, human written the very existence. Say I say the happy hypoxia example. The normal respiration is SORA. Sudden fright may cause a sudden spasm in the respiratory tract and thereby stoppage of the air inspirations, and this may then cause into panic, air intake, are the basics of life. So most of time, the sudden fright, you can have lots of patients of pediatric cases where they got frightened easily and they develop pneumonia. Because of time being or a fraction of time, there is spasm and that lead to the compromisation of this basic need. But this need is associated with the mental process called as fright. Okay. So insecurity ensues, and these are mainly the timid constitutions. So mostly the timid constitutions can go into frightful situations or frightened very easily, and they go into the state of panic. Okay, so the timid constitution need some support. The timid constitution needs some support and security. So in that case, air is represented as support, because without this support we cannot survive. Okay, so air is the support. So mostly timid people require the support, and that is the air. Okay. Now the second biological need, which we call as the water. So in a water, the second circulatory system that carries the air and oxygen to the all parts, the organ and tissue of the body, it mixes with the human. This is a water-based transport, and that water is the second element most important for the survival. Okay, if the water system is not there in our body, then what happens? We can take the air, but air cannot go into the human, to the particular organ and system. So this is again compromisations. So this is what water is connecting every cells. Water is connecting the every cells, every organs, every tissues of the body. Okay. So if there will be no transport of the air, no water or auto. So water is form of bonding and connecting the all things. Okay. So when you are taking care of everybody, you are bonding with everybody, and you are connecting with everybody. What was that need? So water is the need of love. So air is a support, water is a love. Why? Because water implies the smooth flows. It creates the bond, embraces or help to embrace all tissues, organ and cell, help to form the family. So from one family, one cells to the different cells, we have a case metastasis. So in a metastasis from one cells to another cells, it goes into different family. So this is what same. So water is the love. And third basic need was food. So little bit quite theoretical, but this is very important to understand, because in a coming lectures, this is not taught. In a coming lecture, we are going to have a practical approach to particular needs, because we know these things is associated with this process. So air is a support, water is a love, and this food. Food is nothing but uh, it's a process. Sorry for disturbances. It was a projector shut off. It takes time. It takes time. Don't worry. It takes time. So what is water? So food is the necessity to produce the energy. For energy, we have an intake. We need that foods. And without food, we can survive for a few days. But after that, we can't. Without air, we cannot survive for minutes. Okay. So food produces energy, because food when ingested, it absorbed, it assimilated, and it goes into humors and converted into energy. So this our human systems or our cells is producing this process. Okay. So it is food is called as a raw material for the production of energy. Same, water is considered to be the raw material for the production of energy. Air is also considered the raw material for the production of energy. Okay. Let's see, Johnny. Yeah, red se nahi chalu kar. Okay. So this is the raw material for energy production. Now, food has a certain things. We have a likable foods or non-likable foods, because some person need this kind of taste, some person need this kind of taste. So this is a like or dislike. So food component has a like and dislike. Enter. बच्चे enter. Food component has likes and dislikes. Sorry for disturbances. So it's okay. Every human being born with the feeling that they have to do mistakes and learn from mistakes. Okay. Food is unlike air and plain water, has a taste and describe likable and not likable. So in that component, see what was air was very basic. It was the support is needed. The water is also needed to bond with everything. But this food is choosable. It can be likable. It can be not likable. So in that food, as long as it is used as a need, when the food is used as a need, say for example, मैंने जो example दिया कि एक जो बच्चा है जिसको खाना मिलता ही नहीं है, तो उसके लिए food is a need. Whereas the person born in a silver spoon family, they don't have a need of food. They have just, it is called as taste and luxury. This is called psychosis. For that, it is psychosis. But when the person has no food at all, then for that they are sora. Okay. So food made as per taste and luxury, it is psychosis. So and the last things, aversion to certain foods, or aversion, no interest in the food, and indifferent to food, never hungry. This is going towards destruction, because food gives energy. Okay. Nowadays we have seen lots of people doing a diet, keto diet and that diet and everything, and they are compromising that foods. Why? Because they are already in a psychotic state of obesity, and they wanted to be because their need was aesthetic needs. I need to be a beautiful, I need to be a slim, my tummy will go down inside. So this was the need, and due to that need, they again goes into process called as avoiding the foods. They go into very harsh dieting state, and they go into state of syphilis. We have a rubric: suicidal disposition, starvation. Why? The remedy was mercury. So you can use, but this is just a rubric. Okay. So the third basic need was this, and so this need, food need, was considered to be a esteem because it is a part of our psychosis, luxury. Okay, when we go into, see, Surat is famous for food. And we have lots of luxury in the food in Surat. So this is psychosis. So when this is psychosis, it is associated with the cognitive, it is associated with aestheticness, it is associated with the esteem. So this is associated with the esteem need. Okay. So every living thing on this earth and universe wants to live. This is the basic right, survival of the fittest. When every living thing has particular need, and that biological needs are basic air, food, and water. If either of these need not satisfied, if either of these need is not satisfied for living, they being feel insecure and traumatized. So this is what trauma starts here. In your time, you said small kid. In a small kid, they need certain foods. Say for example, Maggie. They ask for Maggie to mommy Maggie. I want Maggie, and mother is busy not making Maggie, and mother says you need to eat the chapati. And again, that was a compromise. So that was also ST. That was affected. So when this is happened, this basic need was compromised. This goes into insecurity, and this goes into trauma. So many a time what happened, mother tell to you that सर मेरा बच्चा खाता ही नहीं है, चपाती नहीं खाता है, वो नहीं खाता, ये नहीं खाता, ये नहीं खाता, मैगी बना दो तो खाता है, बाकी कुछ खाता ही नहीं है. And this goes into this trauma. So this is what the basic needs. Okay. So when this insecurity and traumatized because of not getting this basic need. So what happened? That this insecurity and trauma are the cause of starting of all illness. So Sora begins from this. Soric manifestation begins from this. But the survival of the fittest is the rule of the world, and every being fights for the survival. So for fight for survival, they started defending three processes. First is physiological, second is morphological constructive, and third was morphological destructive, because fight for the survival. So this is in its own way. See, this own way is nothing but it is a miasm. If person is fighting in a physiological way, it is a soric one. If person is fighting in a constructive way, it is psychotic. Or if it is a person is fighting in the destructive way, it is a syphilitic. Okay. So now what to do to rectify? When the we understood the need, we understood the sensitivity. So for why we need to prescribe the GCS. To prescribe GCS, we need to understand the miasm. For miasm, we have a basic need. The basic need is Sora psychosis syphilis, or basic miasm is Sora psychosis syphilis. Need is air, water, and food. And when this compromise, it started illness. Now we have patient is illness. So to rectify the illness, what we have to do? This was a very important slide of this today's lecture. To rectify this illness, what we have to do? Any guesses? It's an open discussion. You can fulfill the need. Very good. But person comes to us with the illness. How can you fulfill the need? Say for example, a child want ice cream, and child is not getting. Okay, and he developed cold and cough. Say for example, a child want ice cream, and the father and mother is not given the ice cream, and suddenly he traumatized, he develop golden cough, and again child wants that. How can you fulfill? In aphorism number 259, Hanuman mentioned diet and regimen in acute cases. When the patients require any damn thing they want, you should give it to them. It is going to help them to maintain the homeostasis. Okay, so one thing is that desire is fulfilled. But if desire is not fulfilled, what you have to do to rectify the illness? How you have to, this illness can go, cold and coryza cannot go with ice cream. Desire can be fulfilled. So what you have to do? You find out the need. To rectify the illness, the need is most important. How can you know this? See, first and foremost things, when in acute cases, you ask what hurts or what has hurt the living being or what he wanted and did not get. This is the starting point of ailments. So, for example, many a time a lady comes with the pain in cervical pain and is transferred to the right or left side, and the orthopedic diagnose that it is a cervical spondylosis. Okay. Now, the first questions we need to ask: cervical spondylosis. Okay, this is a psychotic state of this vertebral. Inflammation goes into induration stage in the cartilage. So it is that psychotic process. Now we need to find out what has happened here. So many a times sir used to ask, this is man. So man is something called as a esteem. So first and foremost question, what has hurt? If patient says, I don't know what has hurt. What has hurt the living being or what he wanted and did not get. So we directly ask, तुमको रिस्पेक्ट मान चाहिए था, कहाँ नहीं मिला, बताओ. जब पेशेंट ये हिस्ट्री बताएगा तो हमको उसका पूरा परसेप्शन, उसका सेंसिटिविटी, उसका नीड तो पता चल गया. एस्टीम है, क्योंकि एस्टीम है तो ही ये कॉम्प्रोमाइज हुआ है. अगर एस्टीम नहीं होता तो ये कॉम्प्रोमाइज नहीं होता. दैट्स ऑल. सो एस्टीम नीड पता है, पर कैसे हुआ, क्या प्रॉब्लम हुआ, तो पेशेंट क्या बोलेंगी, सर जब भी मैं ना एमबीए पढ़ी हूँ, तो मेरी शादी हुई, नई शादी हुई, अभी तो शादी को 10 साल हो गए. एमबीए पढ़ी हुई, शुरू में जॉब किया, 3 साल किया, फिर बच्चे हो गए, फिर तो मेरी हालत ऐसी हो गई कि मैं घर की काम वाली बन गई हूँ. ये एमबीए पढ़ा, उसका क्या मतलब? सो दिस इज व्हाट शी इज गोइंग टू डीवैल्यू देमसेल्फ. एंड बोला कि क्यों शादी के बाद भी तो जॉब कर सकते थे. तो बोला कि हमारी फैमिली में इन लॉज अगेंस्ट थे. शुरू में तो कोई दिक्कत नहीं थी, पर जब बच्चे हो गए तो उसके बाद इन लॉज ने मना कर दिया कि अभी ये जॉब नहीं करना है, वो नहीं करना है, घर का काम करना है, संभालना है, ये है वो है. एंड दैट वाज हर्टिंग. सो इनिशियली दैट सेंसिटिविटी वाज hurt, and that sensitivity goes into induration, insecurity, and that is stiffness. Right side, because in-laws family is going to not allowing. I need to function. This is for function. I need to perform. This is a day-to-day activity. So she is MBA. I need to function, but nobody is allowing to function. So this was also paining. So this is a correlation. This is what we need to find out the need. So what has hurt and what hurt the living being or he wanted and did not get. So from that we need to have an ailment from. If it is in a soric state, we convert it into ailment. If it is in a psychotic state, we need to find out the fear, insecurity or perception. And when it is in a syphilitic state, then you need to find out the perception with the reaction of what was that reactions. Okay. So that is the, to rectify the illness, we need to find the need. Second point, what is this constitution is sensitive to? First is to rectify, to find out he wanted and he did not get. Second, what this constitution is sensitive to. तो जब भी हम हिस्ट्री लेते हैं तो बचपन में उसका पूरा बचपन का हिस्ट्री पूछने का, क्या हुआ था बचपन में, तो बच्चा बोलेगा कुछ भी नहीं हुआ था, ये है वो है, सब ठीक था, अच्छे थे, मजे थे. तो पूछने का, क्या ज्यादा हर्ट करता था बचपन में, कोई डांटता था वो हर्ट करता था. सर ऐसा है ना कि कोई जोर से बोले ना वो मेरे से सहन नहीं होता, मुझे बहुत हर्ट करता, मैं रोने लगती. तो एकम नहीं होगा ना, वो भी बोलेगा कि हाँ सर ऐसा ही है, इसको किसी और को डांटा हो ना तो भी ये रोने बैठ जाती थी. That was, they are more sensitive to rudeness, harsh behavior of others. So this is what constitution is sensitive to. In that case, we have one lecture on sensitivity. We took the lots of rubric, and for that we have to understand what was that sensitivity is. So this is what, first and foremost, we need what he wanted and he didn't get. Second, what the sensitivity is constitution is, and the third, what is the reactions or how does these things fight to survive. So what was that reaction? See, sir always says the reaction is based on the individual miasmatic process. Sensitivity belongs to constitutions, whereas reaction belongs to the miasmatic state. Okay, so we need to find out the reactions. So for example, I have one example of a lady, a girl child, and she is very sensitive to scolding or reprimand. Sensitive to scolding or reprimand. But the reaction was very different. She always laughed when somebody reprimand. So when the mother is scolding her, she laughed at mother. When father is scolding her, she laughed at. So this is very syphilitic reactions. Laugh at reprimand. The remedy was graphitis, like pulsatilla, but remedy was graphitis. So this is what reaction is very important in every case. Okay. So sir always says sensitivity belongs to constitutions and reaction belongs to miasm. So this is very important of the today's session, and this was the basic need. Maslow has given this need. This was the physiological safety and belonging need is the SORA. Everybody needs safety, everybody needs food, water, air, everybody needs love, care, nurture. This is a SORA. When SORA is going beyond, they develop certain esteem, cognitive and aestheticness. This is called as a psychotic need. And when this goes into self-actualization and transcendence, it is called as syphilitic need. So they're going toward syphilis. So that's all for basic need, love, timid. See, who will need support? A timid constitution need support. So you have to find out the rubric timidity with the support requirement. And who will need esteem? Those who are very high chin, haughty personality, they need respect and esteem. Nobody, no doubt, everybody needs respect and everything. Even timid people can need that things. But this is just a basic classification. These three needs are basic. So mostly those who are timid, they seek for the support, and those who are esteemed, they seek for the esteem need. So we have this remedy having love needs. You can snap it. It's very important. This chart was given by Sir. So chocolate. We will go into this particular remedy further in detail in the next sessions. Okay, but this is very important. Chocolate is chocolate is very political. There is a bitter love, sweet and bitterness same in the chocolates. Okay, politicians, cannabis sativa, very lovey-dovey, opium. These are now elapsed. Manganum. Manganum is also like love, like a sepia. Acid, phos, naxomica, sepia, phosphorus, all phosphorus. Because what was the phosphorus need? Affectionate wants, reaction, affections. This is the basic need of phosphorus. So phosphorus need love. Carbons, carcinosin, sulfur, alumina, these are the love needs. This remedy goes into, these are the timid remedy: calcarea, pulsatilla, baryta group, argentum, kali, silica, alumina, staph. These all needs supports. See, calcarea had the support of, in an initial stage, calcarea is very weak, like a chalk, easily fragile, break. So he needs the supports to walk because bones are fragile. Then when calcarea evolved to certain level, they want to collect the money, so started the basic need of money, started same like pulsatilla also collecting the money. Pulsatilla is also money minded. So in that money minded remedy, okay, Baraita group, when adult cannot be taken a responsibility to a certain age and they have to depend on everybody, this is Baraita. Late coming into usefulness, this was the word used by Kant. Late coming into usefulness. Okay. So this is the support need. All Ophidia need supports. Why Ophidia need supports? They need support from some superhumans because they are being controlled by some superhumans. So they seek support from superhumans. Okay. So this is the basic needs of support, and these are the esteem needs. There are many remedy which comes into all three needs. Okay. Sulfur is one. So it can be every person need these things. So these are the natrums, ignatia. Natrum is highly egoistic remedy. Ignatia positions, my position. If my position is compromised, if my rank is not coming into my level, then I suffer. So this is what esteem needs. There. Okay. So in the next sessions, until next time with remaining need, we are going with the love. The one lecture on the love, second lecture on the support, and third lecture on the esteem with certain rubric and differentiations and learning. Thank you all for patience listening. Hope after 1.5 years I took this lecture. Initially also I had taken lecture, but I feel very grateful that you are here to listen these things. Thank you. Thank you so much.